So many factors influence reproductive health. Working population, so we have to capitalize on this potential. We also have to be prepared for active aging, and by 2050 we expect that the population will grow till 51. And here we talk about gender dividend and demographic dividend coming together. So women are not re-victimized when they go to police or they go to health facility. Social norms change, and what is happening on the ground. If there is a political will, then of course you can do it in more accelerated way. I think this is also a very important element that not widely discussed in that sense.
How does UNFPA contribute to improving maternal health services, especially in rural areas of Uzbekistan?
Yes. Look, what were the reasons between this specific deaths? Could this be prevented? Not reproductive health education, but we call it healthy lifestyle or life skills education. Have full information about, what is sexual harassment, what is rape, what is HIV.
What are the top priorities for UNFPA?
In gender-based violence, we should work not only with women, but also with men.
And what is your impression about Uzbekistan so far? Hello, today I'm speaking with Dr. Nigina Abbaszadeh, the UNFPA resident representative in Uzbekistan and country director for Tajikistan. Hello, thank you for joining us today.
Thank you.
Could you please tell us briefly about the primary goals of UNFPA in Uzbekistan and how they align with country's development goals?
Absolutely. Thank you very much for the invitation. It's a great pleasure to be here. I will probably start from the broader picture. United Nations Population Fund is the UN agency that is a custodian of reproductive rights, basically. So our mission is to have every pregnancy wanted, to have every childbirth safe, and to promote the realization of every young person's potential. So aligned with this mission, we have similar goals in Uzbekistan. UNFPA opened its office more than 30 years ago, when as soon as Uzbekistan became independent. And we were one of the first agencies which opened the office in Uzbekistan. Of course, core program that we have here is very much focused on maternal health, on reducing maternal mortality, on improving quality of care for women, for reproductive services, for maternal health. And then because reproductive health and reproductive choices are formed within the broader context, so many factors influence reproductive health and many factors influence number of children families want. So we're looking at this from the broader perspective. That's why we're also looking at the demography. We're also supporting country in terms of data, in terms of statistics and demographic analysis and demographic projections. We're also looking at the gender potential, at the women's potential in the country, and supporting gender equality, specifically looking at the protection of women against violence against women, protection of adolescent girls against violence and any kind of abuse. Mm-hmm. And another element that we have is specifically having programs that are focusing on youth potential and also supporting older persons as well.
And what are the main challenges UNFPA has faced in achieving its global targets, such as zero unmet need for family planning and ending preventable maternal death in Uzbekistan?
Yes. On the global level, there are different dynamics, and sometimes we see backlash in relation to women's rights and especially in relation to reproductive health. At the same time, overall, the world is moving towards the direction to realization further women's rights and, reproductive health. And we also look at this from the perspective of demographic resilience. Because either we look at from the declining fertility or from the high fertility country, we still need to we need to make countries prepared for demographic resilience, meaning that countries have to be prepared in terms of what is expecting them into the future. So if we look at the high proportion of working population, so we have to capitalize on this potential. If we know that there will be increased number of older persons, we also have to be prepared for active aging or for adaptation of the health services, social protection services, etc. So demographic projection, demographic analysis, demographic data serve as a very much basis for evidence-based policies for the future, for the current planning. So this is very important factor, and we look at this from the demographic resilience perspective, basically.
Yeah, it's good that you talked about the demography, and recent years, Uzbekistan has experienced rapid demographic changes. And what are the key challenges and opportunities in the context of Uzbekistan related to that?
Mm-hmm. Yes, it's a very good question, and we, as UNFPA, we invested efforts into, coming to specific population projections. Mm-hmm. So, based on that population projections, we see that the population of Uzbekistan will be growing, and by 2030 it will reach over 41 million. And by 2050, we expect that the population will grow till over 51 million. So this means that it creates both risks and certain opportunities, right? And here we come to the potential demographic dividend. What does it mean? It means that the cohort of working population will be also growing. So we know that by 2030 it will be over 25 million of working population in Uzbekistan. By 2050 it will be over 33 million of working population in Uzbekistan. So that constitutes already a big potential if we invest into human capital development, and that leads to economic growth. So this is what we call demographic dividend. And from that perspective, there is another element which we call gender dividend. So within cohort of working population, at least 50% are women. So if women are at the labor market, if women are actively, economically active, then it's another boost. It's another, accelerator for economic growth. And here we talk about gender dividend and demographic dividend coming together, and basically contributing to significant economic growth. And this is a very important opportunity for Uzbekistan to build on and to capitalize on.
And can you share specific programs or projects, initiatives led by UNFPA to combat, for example, gender-based violence in Uzbekistan?
So in Uzbekistan, our primary focus was on establishing or supporting government in establishing multi-sectoral, coordinated and integrated response to gender-based violence. So women are not re-victimized when they go to police or they go to health facility or they go to for social services. Specifically, we're working very closely with the National Agency on Social Protection to support them for integration of services into the social package, basically, and specifically training or capacity building of the INSON centers to have them as a soft entry point. What I also want to highlight, our partnership with Mahalla Association. This is another very critical partner because we need to look at the social norms change and what is happening on the ground. And here we need to work with the communities. And that's why Mahalla as an institution is very critical entry point for us. And then also another partner that we work is the Islamic Academy. Because we also bring the protection of women from Islamic perspective. This is another element. Basically, all our programs are culturally based, like culturally aligned and culturally sensitive. We're trying to make them all context designed, context driven. Then we have a number of media programs, also media projects that are where we produce, cartoons or videos that address specifically violence against women or communicate specific message on services, for example. Probably you noticed recently we had very successful media project that was called Gızımga, meaning that letter to my daughter. And this was a production jointly with the National Agency of Social Protection on mobilizing very prominent culture figures or bloggers or prominent people who have like very high respect in the society to talk about their attitude towards their own daughters, how they support their daughters in terms of education, in terms of what advice they would give to their daughters, but also how fathers stand behind their daughters, how they are supporting them in the future. And this was very successful program, media project that we had, and multiple other projects.
So there is a fifth country program. I read about it for 2021 and 2025, and UNFPA envisions reducing maternal mortality by 1/3 and ensuring no one is left behind. Could you please tell us about the key achievements so far and what challenges are remaining according to this country program for these years?
Yes, I think that, I wouldn't attribute our achievements just to UNFPA because the context in which we operate is very important. If there is a political will, if there is the full engagement of the government in addressing the issues, then of course you can do it in more accelerated way. So for that reason, I would like to highlight that the commitment that is coming from the government, especially in the area of maternal health, reproductive health, and women's rights, is absolutely critical, and this accelerates the progress. So unless you talk about challenges openly, you cannot address them. So that's very important.
And let's talk about the climate change and population dynamics.
Yes.
Are there any discourse on that, about the interrelation between climate change, sustainability, and population dynamics? For instance, are there any specific projects addressing the intersection of these two areas?
Yes, we look at the climate change first, how this connects to the population dynamics, as you said. For example, concentration of population, let's say like Fergana is highly populated area in Uzbekistan. How this is linked to water management, for instance, right? Etc. So we look at this from that perspective, and that's why demographic data is absolutely critical in that sense. Then another element that we look at this is also impact of climate change on women's health. So this we also cannot neglect because this also leads to increasing maternal mortality, degrading health of women and newborns, etc. Because the air pollution, water sanitation, all of this have very significant impact on women's health, and also, of course, children's health, etc. I think this is also a very important element that not widely discussed in that sense.
How does UNFPA contribute to improving maternal health services, especially in rural areas of Uzbekistan?
Yes, that's a very good question. So a multiple level of engagement. First, of course, line Ministry of Health. With them we work on improving protocol standards, and so it's centralized and has a standard approach in terms of quality. The second level is specifically working directly with the reproductive health and maternal centers. Now we are, equipping over 230 maternal hospitals with the equipment that will improve quality of care also. And then also what is also important is that referral between primary care to secondary level. We use specific tools that look at the, we call it confidential inquiry on maternal health, on maternal deaths, on maternal mortality. And we look at every specific case jointly with the Ministry of Health. Like we help them to analyze this data and to look at what were the reasons between this specific deaths. Could this be prevented? What were the specific factors that contributed to that? Be it, lack of antenatal visits and delayed diagnostic of specific conditions, or be it other factors like sepsis or other things that were connected. So that gives us, we have a specific tools that we work on the analyzing the conditions that could leverage the quality of care, maternal care specifically. I also would like to highlight that the family planning is very important element for safe motherhood. Because if there is no spacing between births, that puts risks on women's health. It leads to anemia, it leads to additional conditions that could then bring to either maternal death or different kind of difficult condition for a newborn, etc.
Let's talk about youth engagement. What are the main challenges in providing comprehensive health education, reproductive health education in Uzbekistan?
Well, I think this is one of very significant challenges that we see, and lack of comprehensive knowledge about their body, their health, and we call it not reproductive health education, but we call it healthy lifestyle or life skills education, because as soon as you invest into knowledge about your health and healthy well-being, like non-smoking, no drug abuse, addiction, etc., as soon as you invest into that, you build very resilient youth. And this means that these young people will be resilient at the labor market. And also they will not allow any kind of abuse or harassment at the workplace, etc. So this is still, there is still room to address, and we would like to have life skills education to be integrated into school curricula, so especially children who are in 8th grade and above or 7th grade and above have full information about, what is sexual harassment, what is rape, what is HIV, what is drug addiction, and how to prevent yourself from that. And this is very, very important. We also connected to the concept of body autonomy, because we think that girls have to own their own body. They have to know, have basic knowledge about their health. And this also leads to, to safe motherhood also. It also leads to the safe deliveries and women being healthy also at the later stage.
Let's go back to the topic of data collection and analysis. You said that data collection is crucial for policymaking, for evidence-based policymaking. How does UNFPA support Uzbekistan in conducting, for example, population censuses and improving data quality?
From our side, as UNFPA, we work for many years or for several years in a row to build the capacity of National Statistical Office. Also, to bring expertise from neighboring countries to have lessons learned, how this was done in similar context. But also there are other elements, digitalization of census, like training of the remunerators, organization it like the pilot census, analysis of it, how this lessons learned to be integrated into household service census that will be nationwide. And this is household exercise, so people have to open their doors for remunerators. That's why they have to be aware that this exercise will be happening, and that's why usually in many countries census is accompanied with big communication campaign.
Yeah. To sum up, what are the main challenges in Uzbekistan, and what are the top priorities for UNFPA program in Uzbekistan?
The priorities remain the same. It is maternal health, reproductive health. I would say that we put more efforts into family planning here in Uzbekistan, more awareness of population, couples, women, men, about family planning, the advantage of it. And then another area where we work, and we see it also as an issue, it's of course cervical cancer and breast cancer. Unfortunately, we see quite high, prevalence of mortality among women, and this is again because of late diagnostics and access to services. And then on data and demographics, we remain to be working on this area, on supporting governance of evidence-based policies and demographic projections and planning. And of course, we hope that the census will be conducted and we will have a critical role in terms of technical assistance in conduction of the census. And then on gender-based violence, we remain on the multi-sector response to gender-based violence, but also our position is that in gender-based violence, we should work not only with women, but also with men. Because my strong belief is that, and we all believe in that men are very important ally for protecting women's rights and for bringing change. Now, one more element that is also envisaged in our next country program is that aging of population, because based on our projection we see that the population of older persons will be growing. So if we take it by the UN projections, like UN 65 plus category people, then it will reach over 6 million by 2050. If we take it by the national, like 55 for women and 60 for men, retirement age, then it will be over 10 million. It's a quite big cohort, so we also have to be ready in terms of how we prepare for aging.
And Dr. Abbaszadeh, we've talked earlier about your work, about your career, and you've said that you have an extensive experience, around 20 years, more than 20 years. And what motivates you to work in this field?
What motivates? First, I think UNFPA mandates is most beautiful because it works for women and for girls. So this is the future, and this is works for mothers and newborns, right? So we create, the next generation healthy and happy, prosperous, etc. So that's the main motivation. I believe in mandate. It's very important. And even we are Reproductive Health and Rights Agency, as I said, reproductive health or reproductive choices are factored by so many conditions, be it economic, be it social, be it role of women or men in society. So these are reproductive choices are so much interconnected into culture, into religion, into society. That's why our mandate is such a comprehensive and big.
And what is your impression about Uzbekistan so far?
So I'm in Uzbekistan a little bit more than 1 year. I have to say that this is the country that I really wanted to come as my next assignment, and I love it because culture is also resonates to me personally, but also it's a country of opportunities now at this stage. You can do so many things now. Because, as I said, we operate in specific environment. We call it enabling environment. If there is enabling environment to do changes, to bring, to improve quality, improve well-being, then it creates an opportunity. So I see it as a country of opportunities at this moment, and this gives additional added value for your work.
Thank you.
Thank you very much.